Artificial Intelligence Dr. www.abcpharma.net/English. User question: how may the lack of atrial pacing exacerbate postural hemodynamic changes leading to discomfort? Claude AI answer: the lack of atrial pacing in a patient with a unicameral leadless pacemaker can exacerbate postural hemodynamic changes and contribute to discomfort through several mechanisms. 1. Impaired AV synchrony. In a normally functioning heart, the atria contract before the ventricles, allowing for optimal ventricular filling and stroke volume. The lack of atrial pacing in a unicameral leadless pacemaker can lead to AV dysynchrony, where the atria and ventricles contract simultaneously or in a suboptimal sequence. This impaired AV synchrony can result in reduced ventricular filling, decreased cardiac output, and less efficient blood circulation, particularly when changing positions from standing to lying down. 2. Reduced atrial contribution to ventricular filling. Atrial contraction normally contributes up to 20–30% of ventricular filling, especially in older individuals or those with impaired ventricular compliance. Without atrial pacing, the atrial contribution to ventricular filling may be diminished or absent, leading to reduced preload and cardiac output. When changing positions from standing to lying down, the reduction in venous return and preload due to the lack of atrial pacing can be more pronounced, leading to greater hemodynamic instability and discomfort. 3. Impaired baroreceptor response. Baroreceptors are sensory receptors located in the blood vessels that detect changes in blood pressure and send signals to the brain to regulate heart rate and vascular tone. In patients with a unicameral leadless pacemaker and no atrial pacing, the baroreceptor response to postural changes may be impaired due to the lack of physiologic heart rate variability. This impaired baroreceptor response can lead to a delayed or inadequate adjustment of heart rate and vascular tone when changing positions, contributing to hemodynamic instability and discomfort. 4. Exacerbation of underlying cardiovascular conditions. Patients requiring a pacemaker often have underlying cardiovascular conditions, such as heart failure, valvular disorders, or coronary artery disease. The lack of atrial pacing and the resulting hemodynamic changes can exacerbate these pre-existing conditions, leading to worsening symptoms and discomfort when changing positions. For example, in a patient with heart failure, the lack of atrial pacing may lead to further impairment of ventricular filling and ejection fraction, causing increased congestion and dyspnea when lying down. 5. Neuroendocrine and autonomic imbalances. The lack of atrial pacing and the associated hemodynamic changes can also impact neuroendocrine and autonomic function. Alterations in the release of hormones such as natriuretic peptides, renin-angiotensin-aldosterone system activation, and changes in sympathetic and parasympathetic tone may occur in response to the hemodynamic changes. These neuroendocrine and autonomic imbalances can contribute to fluid retention, vasoconstriction, or other physiologic responses that may exacerbate discomfort when changing positions. To mitigate the impact of postural hemodynamic changes in patients with a unicameral leadless pacemaker, several strategies can be considered. 1. Optimization of pacemaker settings, such as increasing the base rate or enabling rate-responsive features, to improve hemodynamic stability. 2. Gradual position changes and avoidance of sudden postural shifts to allow time for hemodynamic adaptation. 3. Compression stockings or abdominal binders to reduce venous pooling and improve venous return. 4. Adequate hydration and salt intake to maintain intravascular volume and preload. 5. Consideration of upgrading to a dual-chamber pacing system if symptoms persist despite conservative measures. Consultation with a cardiologist or electrophysiologist is essential to develop an individualized management plan that addresses the specific needs and underlying conditions of each patient with a unicameral leadless pacemaker and postural hemodynamic changes.